Stool sample. What is a stool sample? A stool sample refers to a small sample of feces collected for medical analysis and diagnostic purpose. It is commonly used to detect the presence of bacteria, parasites, viruses, and other substances or organisms that may indicate gastrointestinal infection, digestive disorders, or other health conditions. As we all know that stool samples are commonly used in the diagnosis of the gastrointestinal infection. They help identify the presence of pathogens such as the bacteria, viruses, or parasites that may cause the infection. By the analysis of the stool sample, doctors can determine the specific organism responsible for this infection, and then a proper treatment will be conducted. So this is about the stool sample, and now we move towards the next slide, which is about the sample collection. To collect a stool sample, you will typically be provided with a sterile container by your healthcare provider or laboratory. The sterile container means those containers which are totally sterilized, and there is no chances of the contamination in it. It's important to follow the instructions before to ensure the accurate results. Choose a clean and dry container. Always use a clean and dry container. Do not use any contaminated container for the stool sampling. Collect a stool sample. Avoid the urine contamination. Fill the container, secure the lid, label the container, and transfer the sample to the medical laboratory safely. As you can see in this figure on the right side, there is a steps for the performance of the sample collection of stool sample. The first one is about the put on gloves. Second, sit on provided metal pot. Make sure pot is clean. Do not allow any water to enter to the pot, because water may also contain some contaminants, so do not allow the water to enter to the pot. The third one is the poop into pot. Fourth, open stool container tube. As you can see, this is the container tube which are going to be used in order to collect the stool sample. Number 5 is use scoop to collect the portion of stool from the pot. As you can see in this figure, there is a small scoop which are going to be used as a for the collection purpose in the stool sample. At number 6, place the stool sample and scoop into the stool collection tube and seal securely. Place collection tube into stool sample kit along with the fecal swab tube. As you can see how the stool sample will be going to transport. This is the sterile bag in which the this is a sterile bag in which the stool container tube and the swab sample are properly placed, and then it is ready to be disposed. But one of the major and the important thing is, firstly and always mention the container tube with the proper labeling with the patient's name or the patient identifier number or something else, and then transport the samples with safety towards the medical laboratory in order to examine for the further process. And the 8th number is throw away gloves and wash hands. Washing hands is one of the best way in order to prevent from the infectious diseases, as we all know that. This is the 8 steps which are going to be used in the sample collection of the stool. The next one is that stool culturing. When the stool sample is safely and properly transported to the medical laboratory, then what the medical technologists do? It performs the various methods in order to identify the infection or any type of the health condition of a patient. The first number is the stool culturing. This test involves placing a small amount of stool on a culture medium to allow the growth of bacteria or fungi. The sample is then examined to identify the specific microorganisms causing the infection. Additionally, the isolated bacteria or fungi may be tested against different antibiotics to determine which one are the most effective in treating the infection. As we all know that after the culturing in the medical laboratory, the next step, which is also one of the major part of the culturing, is the antibiotic sensitivity test. So in this antibiotic sensitivity test, we are going to determine which one of the medicine is going to be very effective against the targeted pathogen. So this is about the stool culturing. In this process, in actually the stool culturing is a process in which a small amount of a stool sample is placed to the specialized growth medium that provides the necessary nutrients for the microorganisms to grow. The sample is then incubated under the specific conditions at the 37 degrees Celsius that promote the growth of the different type of pathogens. Once the organism have grown, laboratory technologists can observe the characteristics such as the Clooney, appearance, size, color to help the specific type of pathogen to identify. Culturing stool samples can be particularly useful in diagnosis bacterial infections such as Salmonella or Shigella or other type of microorganisms. So this is about the stool culturing process. The next one the next one is about the tests which are also be used in order to detect the infection or any type of the parasitic infection is the oval or parasite examination. In actual, this test is used to detect the presence of parasites such as the Giardia, Cryptosporidium, Entamoeba histolytica, Lamblia. These all are the parasites which are going to be detected by this method. And this method name is oval or parasite examination, or their eggs ova in a stool. The sample is examined under a microscope to identify the any parasites or the eggs. In actually, this ova and parasite test is a specific type of examination performed on a stool samples to identify the parasites and eggs in the stool. This test is commonly used to diagnose the gastrointestinal infections caused by the various parasites. As we all know that this is one which is written about the Giardia, Cryptosporidium, Entamoeba histolytica, etc. So this is about the test, and you can also see there is the figure number 1, which is the ova parasite stool test. In this figure you can see there is the 4 steps. This is the 4th step of the procedure in order to perform the test. As you can see, this is number 1 is to collect the stool sample. The patient is given a sterile container to collect a small amount of stool sample. It is essential to follow the specific instructions provided by the healthcare provider to ensure the accuracy of the test. And then second number is there is written is a centrifuge separates parasites and ova, in which in the laboratory a trained technologist take a small portion of the stool sample and prepare a thin smear of the concentrated solution depending on the specific laboratory protocol. And after that you can see the sample is added to the slide with contrast dye. The sample is then totally stained with the specific dye. Then after that the laboratory technologist will carefully scan the slide looking for the presence of parasite eggs, larvae or adult forms. After staining techniques may be used to enhance the visibility and improve the identification process. As you can see at the point number 3, the sample is always firstly stained with a different type of dyes, and then the laboratory technologist will be going to examine the slide under the microscope. The first number is about the collection of sample. The second is the separates the parasites ova through the centrifuge process. And the step number 3, sample is then stained with a different type of dyes. And the fourth number is then technician then look at the sample under the microscope. And the 5 number is always, and one of the most common step is that report and diagnosis. The technicians record their findings and identify any parasite present in the sample. The results are typically reported to the healthcare provider who ordered the test. So this is the 4th steps, and how that step is going to be completely done. As you can see in the figure number 2, there is a cryptosporidium. How the cryptosporidium looks like under the microscope. You can see this is the very fine picture of the cryptosporidium under the microscope. You can see here. So this is all about the oval and parasite examination. If there is any kind of the gastrointestinal infection, then we can perform the stool culturing and the antibiotic sensitivity testing. And if the patient have if the healthcare providers are ordered the test of the oval or parasite examination in order to detect the parasite, then we use this test through which we can detect the different type of parasites. As you can see, there is a Cryptosporidium, Entamoeba histolytica, Giardia, etc. The next one is about the fecal old blood test, FOBT. This test is used to detect the presence of blood in the stool, which may indicate the gastrointestinal bleeding caused by the infection or other conditions. It involves adding a chemical to the stool sample that reacts with blood and producing a color change. As you can see in this figure, there is a hemosport card through which a stool sample is completely placed on this, and after that there is a blue color dye which are going to be added on these slides, and after that if the color is going to be changed, then there is a presence of the some infection also. So this is the test is also be used in going to diagnose or detect the infection of the gastrointestinal bleeding caused by the infections. There is a various infections, there is a various types of bacteria, viruses, fungi which may cause the gastrointestinal infections in the human body, and gastrointestinal infections are going to be very severe or complicated when it is not treated properly. So this is the different type of tests are going, and this is the different types of the methods, like the, as we can discuss earlier about the culturing, and then there is the oval and parasite test, and this is the fecal old blood test. These all are the methods which are used to detect the different type of infection in the stool sample. And after that, this is the last slide, and which is mostly belong to the which bacterial infection caused the GI tract. As we all know that if we want to diagnose the infection which are relevant to the GI tract, then we must perform these type of methods. And the samples which are commonly used is the stool sample. So which type of bacteria cause which type of disease, and what are the signs and symptoms, and the mode of the transmission, and which diagnostic tests are going to be used here, and what are about the antibiotics. So this table are going to be very precisely, and it is will going to make such a huge diverse experience about which bacteria cause which type of symptoms, or which or what about the mode of the transmission also. So the first one is about the cholera, and the pathogen which caused the disease is called the Vibrio chloriae, and the signs and symptoms include a severe diarrhea and fluid loss, potentially leading to the shock, renal failure, and death. So these are the very severe signs and symptoms. And the mode of transmission, how the Vibrio chloriae are going to be transmitted, it is the mode of transmission is the ingestion of contaminated food and water. And if a person who is suffer from the cholera, then we diagnose this a disease by the following diagnostic tests, such as the cultures on the selective medium TCBS agar. TCBS agar is used in order to detect, in order to visualize the growth of the Vibrio chloriae, and it is also, and after the growth, the oxidase positive with fermentative metabolism means oxidase test will be going to perform. And the antimicrobial drugs, as you can see, tetracycline, azithromycin, these types of drugs are going to be used in order to treat the cholera. So this is about the cholera. As you can see, this is the disease, and then you will come to know which pathogen cause which disease, and what are the signs and symptoms, mode of transmission, diagnostic test, and the antimicrobial drugs also. And at the third point number 3, you can see there is a Clostridium difficile infection. It is mostly the pathogen which is caused this disease is the Clostridium difficile, and the signs and symptoms include the pseudomembrane colitis, water diarrhea, fever, loss of appetite, dehydration, and this is the perforation of the colon, septicemia, shocks, and death. These are the signs and the symptoms. This is also relevant mostly to the chronic signs and symptoms. But if the infection is at the acute level, then mostly the fever, abdominal pain, loss of appetite. These are the common symptoms which are going to be appear at the initial stage of the infection. And after that, the Clostridium transmission mode is the overgrowth of the Clostridium difficile in the normal microbiota due to the antibiotic use. So these bacteria are going to be colonized in the human body if we use the antibiotic for a long period of time, or if the patient who is immunodeficient, hospital acquired infection in the immunocompromised patients. And what about the diagnostic test? This bacteria are going to be detected in the stool sample. As you can see, we can analyze this bacteria through the stool sample. Detection of toxin in stool nucleic acid amplification test and PCR. Actually, these are the nucleic acid amplification PCR, ELISA. These are those tests which are relevant to the molecular biology. So we can use this test in order to detect the pathogen and getting more precisely and effective results in a very short period of time also. And then the antibiotics and those antimicrobial drugs which are going to be used in order to treat this infection is the discontinuance of previous antibiotic treatment. Vancomycin, these are those antimicrobial drugs which are going to be treat this infection. And the last one is about the E. coli infection, and the pathogen is the ETEC. This is the strength of the E. coli actually. So the symptoms are the water, diarrhea, dysentery, cramps, fever, chills, dehydrations, possible severe complications such as the hemolytic uremic syndrome. Hemolytic uremic syndrome is a very severe form of it is a very severe form, and it is one of the most specific symptoms which are relevant to the E. coli. And the mode of transmission of the E. coli is the ingestion of the contaminated food or water. And then about the diagnostic test, the diagnostic test of the E. coli is the tissue culture, immunochemical assays, PCR, gene probes. These all are the molecular biology techniques which are going to be used in order to detect the E. coli infections. And the drugs which are going to be used in order for the treatment, this is not recommended for these two strains, EIEC and EHEC. Fluoroquines, rifaximin, and TMP-SMZ, possibly for the ETEC and EPEC. So these strains will be going to be treated with these type of antigens, and these are the fluoroquinolones, doxycyclines, rifaximin. These are the antibiotics which are going to be used in order to treat the E. coli infection. So this is all about the bacterial infections of the GI tract. Or in order to prevent from these type of pathogens, we have to take the some measures of the prevention strategies, like by the performance of the hand washing in our daily routine, by wearing mask, and by maintaining a social distancing. These are those SOPs which are be followed in all around the world, in all around the globe. So these are those pathogens which are properly designed according to the international standards in order to maintain efficacy and the prevention levels from the infectious disease also. So this is all about the stool samples.